Hey, everybody's waiting for this video. I'm sharing a little bit about my last 6 years trying to fight acne, chronic condition. I have a woman adult acne, usually related with hormonal changes, and this started in 2013 when I started to have more red acne and some yellow heads. Then I had my first treatment with spironolactone. That is a mild light medication that can be used in lower doses and higher doses. Is a diuretic, usually used for high blood pressure condition. And then they discovered that this drug has effects blocking some hormones to attach to the skin cells and then have less reaction when that hormonal change happen during your cycle during the month or with age. Then I know there are many people, women suffer with that, and I have a long story and long journey on that. Is not done, is a journey, never would be done maybe, because my genetics probably helps too. So in 2013 I had this medication first, and then didn't work well. It was not enough. Then we went to the maximum doses, and I was treating for three dermatologists in Brazil, and then we went to Accutane. So I used Accutane for 6 months for the highest doses ever, and then few months later I started to have again, and it was a little worse, and usually like never worked really well. Then I went okay, I used all the over-the-counter products, all you can imagine, so all the basic treatment acne you can find. Then 2015 I met my husband, and then he bought to me some products from Proactive. Then they promise you give your money back. It was a pain to have that money back because it didn't work. I will see if I can find more pictures and share with you on the next video, or maybe in my social media, pictures from 2015 from my face. Then during this process, during 2015, I was trying to control just with skincare. Didn't take any medication, but always going to dermatologist again, and gave me prescription. Clindamycin was all the time, as antibiotic in like a cream tube, and then didn't work. So 2016, before I moved to US, before my wedding, I had a new treatment with Accutane again. My doctor gave me like, let's try again and see if it works. So usually Accutane does not work for adult acne, hormonal adult acne. So that is all usually in that area here in our face. So I was miserable. My mucosas was like bleeding, my nose, because everything is dry when you use Accutane. And then I had a bunch of antibiotics. Clindamycin is as a spot treatment, and I have a tretinoin that is the same kind of compound that's Accutane, but for topical treatment, and then retinol, and to take care of the scars and the melasma and all the bad stuff. Then 1 month before my wedding, my mouth was like cracking. It was all bad and dry, and my skin was really raw. Then the doctor said, let's stop, because it will not work, and it's not working for a long time, and I need to be better for my wedding. So we stopped. Then I moved to US, and then I had 6 months later I had a very big condition with food intolerance. I developed a lot symptoms from with IBS, and there's irritable bowel syndrome. And then from there I went to the hospital, and they never found anything. I never had any exams positive for any allergies. But since 2017, from the episode of a pain in hospital, I never became better. So my skin condition was just becoming worse, and I developed a lot big, deep cystic acne that last year I could not move my neck. Like February or March last year, I needed to go to the doctor's office to do hydrocortisone injection, that is steroid injection, to decrease the size of my cystic, because all my lymph nodes here would be inflamed, because everything would be inflamed. So this took me some nights of sleep, because it was very depressing and painful, and self-esteem, garbage, confidence, garbage, because your face is the first thing you show up to people, is your face, and it's all the time disgusting. So I was moving to a new country, trying to meet new people and know more people, and then like this terrible stuff come together. So my emotions was like up and down. So the stress, of course, will make worse the acne, all because helps the change of hormonal change with the high stress, but it still was not good. Then 2017, you can see on the pictures I'll share later in this video, you see 2017 pictures, how my skin was. And then I was looking for options. So I went to a medical spa that they promised to be specialized in skincare and hormonal acne and all that stuff. So they promote that a lot. So they convinced me to do a hormonal treatment, because they said that would be the solution for me. I should do. So they gave me a prescription for progesterone, testosterone, and thyroid medication. So they saw my thyroid and they said that was low, and the lower is normal, but the lower, in the lowest part of the normal. And then I was so despair for solution, and I believe in that junk and that people. So the registered nurse, is the owner, did a bad job with that treatment. So they gave me, I was injecting testosterone on my butt every week, and then taking progesterone every morning. And then the doctor saw me there, and the doctor checked my blood pressure, my fever, if I had fever, and this was the only thing the doctor responsible for that spa gave to me. So 2 weeks later, after that, my acne was insane. I had acne from my neck to all over my back, like a 16 years old boy. And so I was fatigued. I was having a lot of the symptoms, of course, because I had absorption issues with my GI issues. Then they convinced me that this was part of my hormonal imbalances, and then I just believe it, and it was bad. So I stopped to use that medication or that treatment in maybe, I don't know, 3 or 4 weeks, because I was all the time complaining, it's not working, it's making me worse, and they never took right. So we went there, and we fought with them, my husband and I, and they gave my money back, and they gave me treatments to cure or to try to remove the scars on my back that I never had before. This was a pain, but like, you have no idea, a frustration, because it was a lot of money. And then I needed to go there every week to burn with acid my back to try to remove the scars. So do not believe in that kind of junk, that spa people, treatment, whatever, unresponsible spas, because there are a lot of good ones. Like, there are good doctors and terrible doctors, like that one responsible for the spa that was terrible, that never gave me any feedback, never really checked myself and see if I was really needing that. Anyway, so mess up all my body more than was messed. Then 2018, I went to another dermatologist. I went in 2 other ones. The other one gave me a lot of prescriptions. I'm gonna try, and then just break. I had a terrible breakouts after that. So I was like, okay, they don't want to treat me. They don't help me to find the cause. They want to try just giving me medications to cure the acne after it is really bad. So, Okay, so my last hope was like, I'm going to the KU, Kansas University. They have like awesome medical high technology there, and then they help me to find, because maybe there are a lot. I know the basic as a veterinarian and as a doctor. I know the basics. So I went there, talked to her, and said, I told all my story, all the amount of medication I have done. I went to the previous doctor before the KU. He referred to KU because he said, I don't know what to do anymore. I was using spironolactone, doing the hydrocortisone injection. This was last year, March, April. And that was not working and it was coming back. And then he told me, I will refer you to KU because they can do something better than I can. So I went there. The lady, the doctor, dermatologist, came first. The doctor assistant, I don't know the name, physician assistant, he doubted about the doses I was taking. And I said, well, you can just call my previous doctor and ask to him. So he did not believe that I was taking high doses of spironolactone and my acne was not going away. Then, and I told him my period is messed up because when you get in the point of a high doses, everything can be worse. So my period was not consistent. I was a mess last year. Then I stopped with the medication because it was terrible again. And then the doctor came to the office and she exactly in that position told me, I cannot help you because you don't want to take birth control, because I don't take birth control for years, and would be an option for you to help to control your skin or acne. And I don't want you, and you don't want to take a spironolactone. But I said, I just stop it to use and it's not working. And I don't want, and you don't want to take Accutane. And like, of course, it took forever in my life. I had a bunch of antibiotics. You make me go to hospital with a lot of GI infections after, and then you will give me more. So she said, so we cannot help you because our only way to treat acne is that 3 options, or Accutane, spironolactone, and antibiotics, and the birth control. If you don't want anything, I'm sorry. So I paid $170 or $150 for this appointment and tried to complain with the KU and didn't work. I left there crying as a baby because it was probably my 4th or 5th time trying to get a professional on the with help me here, and that didn't work. Okay, so then I stopped it, and then I was trying to look for other options.